I'm really excited to be here. Again, I'm Amy Isenberg. I'm an anesthesiologist down in Wilmington, North Carolina. And the title of my program is Get in My Belly, said with a nice Scottish accent. Nothing after midnight. Oh, patients hate that. It's time to make a change. So next slide. This slide would have been a great picture until the copyright police got on me, but it was a big picture of a fat bastard, Austin Powers' nemesis from Austin Powers 1 and 2. And he's like looking very mean and menacing and threatening. And he's shouting, come here, I'm going to drink you. And that kind of sums up the way all of us feel before surgery, when we're scared, we're anxious, we don't know what's in front of us, and we haven't had anything to eat or drink after midnight. Next slide. So NPO, nil per os, it's a Latin saying that's famous. It's a favorite of all of ours in anesthesia. And the next slide will kind of tell you who puts this on us. The American Society of Anesthesiologists, they make these statements and come up with these compendiums of recommendations every couple years for surgical guidelines and what we do in anesthesia. And they're the ones who come up with the NPO rules. So next slide. Just kind of go back a little bit. Why do anesthesiologists love empty stomachs? And it's not just because we love borborygmi and like to listen to your tummy when we're getting in close. It's, the induction of anesthesia is pretty much putting you in a pharmacologic coma. And along with relaxing your brain, we're relaxing your sphincters and your protective airway reflexes. And basically anything that's in your stomach can come up and get in your lungs at this time. So we really, really, really try and minimize anything being in your stomach. And in fact, like one of the most terrifying, anesthetic episodes is when we have these patients that come in as traumas. And, before you wreck your car or crash your skateboard and have a bone sticking out of your arm, you have always eaten a giant plate of chicken wings. And so we really, really worry about this. Aspiration pneumonia is very deadly. The death rate is from 20% up to 70%, depending on what's in your stomach and how acidic it is and the particles. And, it leads to lots of morbidity with pneumonias, abscesses, effusions, and, being on the ventilator for a long time and maybe not coming off. So next slide. So why do our patients hate empty stomachs? This is kind of easy to figure out, but patients are hungry. When you're first in line, even at 6 a.m, ready to go back to surgery, those patients are hungry. They haven't had their caffeine. They have a caffeine headache. There's all kinds of adventures in blood glucose levels, and not just with our patients with diabetes, but, regular people feel a little shaky, being nervous and not having any food or drink in their stomach. People are angry and hangry. In fact, I had a patient this week that was just so mean and hateful, and she attributed it to her not having any food or drink, but she made 3 nurses cry, and I spent more time dealing with this the repercussions of her hanger than I did with anesthesia that day. So again, it's an important topic. We have vasovagal events, people pass out, as well as there's hide and seek veins at this point, especially as the day goes on longer with your lower cardiovascular volume. It becomes very hard to place an IV, and patients get stuck multiple times. So next slide. So it's time for a change. And what kind of brought this on? You can put your own inspirational quote here about changing and how we need to look at things and not just do our traditional things that we do all the time. The Europeans come out with data all the time. They're usually a little bit ahead of what we do. We, in our own hospitals, had been doing programs for ERAS, which is Enhanced Recovery After Surgery, which have as their heart enhancing bowel function after surgery. So you return to your normal life a little bit better, a little bit easier, get out of the hospital faster, start eating, drinking, going to the bathroom, walking around, and doing all those things a little more quickly. And at the heart of that is having bowels return to normal faster. So we had started in some of our protocols having patients drink, not after midnight, but 2 hours before surgery, we were allowing them to drink a special beverage. So Also, along with this, the ASA had come out, the American Society of Anesthesiologists had come out with a statement change on the NPO rules. So we were thinking, it might be time to make this change in our hospital too. So next slide. So this is actually the ASA's NPO Guidelines rule. It came out in 2017, so it's 2021. So we're caught up finally. But clear liquids may be ingested up to 2 hours before procedures requiring general anesthesia, regional anesthesia, and procedural sedation and analgesia. Next slide. So, my problem was how, we know that there's evidence, we know that this is a good thing, but how do we bring this change to our hospital system? Next slide. So there were lots of steps, and I had to think about, all the things we needed to do. And it's not just making your rule, but all the people I needed to talk to. And eventually I found out we had to do it for different populations and how to get the change out there. So there was a lot to think about. Next slide, please. So step one was developing our new NPO rule and what were we going to do and what we were going to say. And honestly, it seemed to me to be a very easy thing, like don't eat after midnight and you can have some sips of water, wet your whistle until you get in your car and drive to the hospital, about 2 hours before surgery. But my way of thinking about it wasn't everybody else's way of thinking about it. And, people want things quantified and how many sips can I have and how many ounces is that? And is it water? Is it another beverage? Can I have tomato juice? And what about food? They're always trying to sneak in the food. Next slide. So, from this point, seeing the confusion, I had to talk to a whole lot of other people, the nurses, the doctors, the different heads of our surgical line services. And I was finding that people wanted a different rule for adults versus pediatrics. And then again, what are the surgical schedulers telling people and what will we need to do to change so that they're telling people the right thing? Next slide. So, we got our rule for the population for adults, and I'll come to that later. We've got the exact verbiage, but, luckily we've got a great pediatric service, and we were able to confer with them about making the drinking, quantifying it for different ages and weights and something that they would be happy with and something they thought was very safe for children. We talked to the different heads of the surgical services. The GI guys don't like red liquids for some reason. So we wanted to stick with just water, clear water. It's always a clear liquid. There's no confusion about water. Next slide. All right. So when it was time to implement this and, give it the good old college try, doing it for the whole hospital seemed like biting off a lot. So we tried it out in a small population. I work at the big hospital a lot, but I'm the head of anesthesia in a smaller hospital, Pender Hospital, where we're just doing cataracts right now during COVID. So we tried out the new NPO rules there and rolled them out, and it was working there. So we started in another one of our surgery centers where we just did elective surgery on healthy patients. So we really wanted to try it out on a smaller subset of our population. And we got really positive feedback. We would ask the patients in the morning, how'd you like being able to drink a little bit after midnight, being able to drink on the way to the hospital? Did you like that? And, no one ever complained about doing that. The nurses liked it because the patients were a little bit happier, a little bit calmer. Was it easier to find the veins? I think so. But the nurses seemed happy and the patients were happy. So I was very happy. So next. So it was time to disseminate the change, get it to the other hospitals or other surgery sites. And how do we get the word out? How do we tell everybody what to say? And we learned very quickly, you need to tell them exactly what to say. And luckily, we had some very good nurses involved with this project that attend a lot of meetings, and they were great at getting the word out. Our nurse, Kim Duggan, was at every department meeting, faculty meeting, every Zoom meeting. I would try to spread the word as well, talking to my colleagues at the hospital and the nurses on the floor, just so patients understood that they could get a little something to drink. They could feel a little bit better before surgery. So next. So this was our exact call center verbiage, nothing to eat after midnight the day before surgery, no food, no gum, no hard candy, no use of tobacco products. We throw that one into. And then here's the quantification: 1 bottle of water, maximum of 2 bottles, up into an hour prior to surgery. Next slide. And so we had to make the order sets to reflect the change. And if you go to the next slide, you'll see that the order sets look terrible. Like, this is all that's involved, like, to make this simple change. And we have to be really good friends with our Epic people to have them help us translate our needs and our patients' needs into something that the whole hospital can understand. Next slide. This is our cute little card we sent out to our pediatric patients with their little pre-op materials, and it goes through exactly what they could have by age, just to make it simple for them to understand. Next slide. This was a photo of Monty Python from the Holy Grail, and there was much rejoicing, yay, part, because people were really happy with this change. I was happy with it. Next slide. And, in conclusion, we have updated all of our NPO guidelines and all of our care sites, and patients are happy, nurses are happy. As time goes on, we're encountering fewer and fewer problems with adventures in NPO. And, I'm still open to hearing any criticisms and feedback, but it's looking pretty good. And I think we made a big change. Next slide. So change is difficult. The NPO rules are very ingrained, but I was lucky to be involved in a project that everybody wants and a change everyone wanted to make. So next slide says, thank you. And only water after midnight, no food after midnight. Don't go crazy drinking the water. Just have a few sips. Thank you.